In 1994, it was shown for the first time that RNA could be used to vaccinate an individual and pass on immunity. Cells would somehow take up this foreign RNA and make the proteins, which when worn on the cell surface would then signal immune cells to begin an immune reaction against this foreign protein. Clearly, this is what happens during, say, a coronavirus infection, where cells take up foreign RNA from the coronavirus and make coronavirus proteins like the red spike protein, and that immune cells could learn to recognize this as foreign, and thus one could then develop immunity against coronavirus after being infected by coronavirus. But it appears that in addition to cells which may accidentally take up foreign RNA, that immune cells known as dendritic cells, this might actually be part of their normal function, that they take up RNA at an infection site, express the proteins potentially coming from a pathogen, so that when they produce these proteins on their cell membranes, this will signal immune cells to begin an immune reaction and develop antibodies against these foreign proteins. While RNA alone or naked RNA is sufficient to promote immunity, there are a number of procedures which can enhance its effectiveness. So the application of an electric current in what is known as electroporation increases the effectiveness of RNA vaccines, as was first demonstrated in 2009. An electric current creates small pores in cell membranes through which the RNA molecules can more easily enter. And this has been used by cells in suspension in a machine known as an electroporator, but it can also be used effectively on the skin where the vaccine is applied. Another way that the effectiveness of the RNA vaccines can be improved is the use of nanoparticles, which were first approved for drug delivery in 2018. Nanoparticles stabilize the RNA and protect the RNA molecules from the enzymes which digest RNA, the RNases. The two RNA vaccines against coronavirus approved in 2020 both used lipid nanoparticles. It is even possible to target specific cell types to receive the RNA vaccine by the lipids in the nanoparticle, which will then interact with specific cell membrane receptors on specific cells. There is some secrecy in the exact components of the lipid nanoparticles as different companies promote their own proprietary processes to develop vaccines. These differences contribute to the conditions in which the vaccines have to be kept. So for example, the specific lipids might mean that one vaccine needs to be kept colder than another in order to maintain its effectiveness. Because this is such an exciting new technology for developing vaccines at a much faster rate, opening the potential for vaccines against AIDS, against cancer, against all sorts of diseases, there are additional techniques being studied, such as different components in the nanoparticles, a nanoemulsion, and then components which will attract specific antigen-presenting immune cells to the injection site. So vaccine therapies are going to change forever based on the groundbreaking revolutionary changes made in response to coronavirus in 2020.